As Australians, we can't even imagine what it's like not to have safe access to surgery and anaesthesia. And yet, for over a third of the world's population, that's their reality. Hung was born with a condition that without correction will prevent him from having children and ostracize him from society. Like many families in this area, Hung's family's options are limited. Since the surgery currently can't be performed locally, they'd need to travel to Saigon and wait for a surgical opening that will never arise, or pay fees that will push the family into even greater depths of poverty. Not much of a choice. So how did this come about? Well, it's complex, but a big factor is that governments have clung to the erroneous belief that basic, safe surgery and anaesthesia are costly and resource intensive. The truth is quite different. For each dollar spent strengthening surgical capacity, $10 is saved through improved productivity and overall health. For comparison, it's a third of the cost of measles vaccinations and 10 times less than the cost of HIV treatment. Supported by Dr. Phiem, who is the director of Thuan General Hospital, Dr. Hu and Dr. V are heading up a change here.
Sustainable surgical care requires investment in infrastructure, but more importantly, it requires training and effective workforce. And that's what we're here in Ninh province to do, to help them achieve their vision. In the next few years, that will involve training surgeons and anaesthetists in the safe care of infants and small children.
The economic and social burden of injuries and non-communicable diseases has a solution. Being part of this change in access to safe emergency and essential surgery and anaesthesia is an amazing privilege. You, we can all be part of this change. What's happening here has an immediate impact. It's ethical, cost-effective, and above all sustainable.